Some worrying news in India's battle against COVID-19. The country is witnessing a rise in COVID active cases driven by spike in daily cases in states like Kerala, Maharashtra, Chhattisgarh, Madhya Pradesh and Punjab. According to the Health Ministry, over 85% of the new cases are from just these 5 states. Maharashtra and Kerala alone account for more than 74% of the country's active cases. In the midst of the rise in COVID cases, India is far behind in meeting vaccination target of 13 lakh inoculations a day. India is still on the phase 1 of vaccination, where healthcare workers and frontline workers are being given the shots. Questions are also being raised as to why vaccination program is not being expanded to give doses to the general population as the cases are spiking. However, beating COVID hesitancy amongst the people is proving to be the biggest challenge for the government at the moment. Anisha Mathur reporting from Delhi and Mustafa Sheikh reporting from Mumbai now join us for the very latest details. First up to Anisha, to Nolan Pinto, who's reporting from Bengaluru. Nolan, we are witnessing and the country is witnessing spike in daily cases in Kerala, Maharashtra, Chhattisgarh, Madhya Pradesh and Punjab. And certain parts of Maharashtra have also gone into partial lockdown, certain in full lockdown as well. The districts and the city-wise, we had just given a breakdown to our viewers as well. What's the situation looking like in Karnataka?
Well, good morning. In fact, in the month of January, if you compare January and February, the share of Bengaluru's particular cases was about 52%. However, there was a spike in the past 5 to 6 days. In fact, on February 16th, the share of Bengaluru's cases when compared to Karnataka, it just rose to about 70%. And it's been about 62 to 61%. In fact, yesterday we had about 413 cases across Karnataka. So when compared to Maharashtra and Kerala, the situation is under control over here. And that's one of the reasons why the government of Karnataka made it mandatory that those coming from Maharashtra and Kerala into Karnataka will have to show an RT-PCR negative test report not older than 72 hours. But
I'm sorry about the interruption, but Dr. Swapneil Parikh, he's joining us. He's the author of the coronavirus book. Good morning, Dr. Parikh. As always, what a pleasure to have you on the broadcast this morning. Dr. Parikh, in your opinion, since you have studied this topic in much detail, even authored a book as well, what is the impediment that the country is facing? We are seeing a spike and a wave coming in 5 different states as well. Questions are now rising on why is it that vaccination cannot be extended to the normal population as well, and why cannot we expedite that particular process?
Good morning. Thank you so much for having me on with you. I think one of the critical errors that we keep making across the world is we keep assuming place X has reached herd immunity and the pandemic is over. And then as we start lifting restrictions, as people start getting back to a higher degree of social interactions, especially indoors, we start to see cases ticking upwards again. This doesn't always happen immediately. Sometimes there can be a lag, especially when a place has a certain amount of population immunity or exposure. It can take some time for the cases to start rising, to the extent that we are seeing now. And this is a novel virus. We don't always understand in real time what's going wrong, but we know what works. We know that limiting social contact works. We know that distancing works. We know masking works. And as we start reopening cities, as we start, especially as public transportation like metros, they start getting operational again, we do start seeing a spike in cases. And it is especially worrying in the context that our vaccination program is lagging. We urgently need to start vaccinating the elderly. We've seen in the UK and in Israel that this has paid massive dividends. It has saved a lot of lives. And we needed to start doing this a week or two ago. But it's still not too late. We need to massively scale inoculations. We're talking about more than 3 million inoculations per day. And we especially need to start...
Really scale up the inoculation. That's the advice coming in from Dr. Swapneil Parikh. Dr. Parikh, just for the benefit of our viewers, and even I'm very curious to know, why is it that there are 5 states that are accounting for over 85% of the coronavirus cases in this particular wave that we're seeing? And let me just name out: Kerala, Maharashtra, Chhattisgarh, Madhya Pradesh and Punjab. Do we have any data to support why geographically these states are seeing that much of a spike compared relatively to the other states?
Well, these states are seeing a spike right now. What's happening here right now might start happening in other states soon. It might just be a case that these areas have more people, they're more densely populated, they have very densely populated cities, they're testing better, and it might be that they've opened restrictions a little too soon. We don't always understand these things in real time, but the important takeaway message is this problem isn't far away in other cities. No matter where you are in India right now, if a city like Mumbai, if places in Maharashtra that have already had a lot of people get infected are seeing surges right now, this could be coming all over India. So this is an urgent issue. And in areas where transmission is low right now, we need to start gearing up to scale inoculations. The problems that are happening today in some states could happen in all states tomorrow.
Swapneil, stay on with us. I want to come back to you to understand more on this particular topic. Don't go anywhere. In the meanwhile, let me also take this across to my colleague Anisha, who's joining us. Anisha, the biggest impediment, as Swapneil also pointed out, is becoming the scaling up of mass inoculation drive in this country. We need to see that scale up ASAP in this country if we want to bring these numbers under control. What is the government planning to do on that front at the moment?
Well, Akshita, what we are seeing is that the first phase of vaccination has been going on, and from various sources we are hearing that the second phase, which is for people over 50, is going to possibly start in another month or two. But if you look at the data that we've got coming in, I'm looking at the Arogya Setu app right now and the COVID data that we've got right now, that about 106,000, about more than 10 crore people have been vaccinated. If you look at Delhi alone, you have the data that is showing that about in Delhi at least you have about 319 sites where vaccinations are being given. More than 6 lakh people have registered as beneficiaries. However, just about 3 lakh people have been vaccinated so far, and that includes the number of persons who have been given the second dose as well. If you look at the data on dosages, that the vaccination that has been given, that is available publicly on the government. That is the government data.
Rising on why mass inoculation drive cannot be scaled up in this country, and that is going to be the big question. Questions going out to the government on why is it that we're seeing a lag when it comes to the common man. Why is he not receiving that jab? Why is it that we're seeing that amount of delay? We also have Mustafa Sheikh reporting from the financial capital in Mumbai. Mustafa, Uddhav Thackeray government has also given out an ultimatum yesterday saying in 7 days, take the due precautions. Otherwise, there is going to be another lockdown. He's already gone ahead and imposed a partial lockdown in several cities, including Pune is going through a night curfew as well. What's going on right there, and what is the sense we're picking up as far as the financial capital is concerned?
Yes, you rightly mentioned, Chetty, there are restrictions on Pune, there are restrictions, night curfew restrictions on Nashik, Amravati and Anchal. There are cities which have gone under lockdown. 8 days time which have been given by CM. At the same point of time, the cases are rising very fast in Mumbai. The death rates are in control, but the cases are rising very fast. And in 1 or 2 days, the BMC can also take this, a decision on some restriction which has to be placed. Because what it looks like that the sentiment of the government is to place restrictions on a local level where the cases are rising and not across a blanket lockdown across the state. There are also reports awaited of the new variants if they have emerged in Maharashtra or not. The samples have been sent to NIV. Soon the reports will come out, and also given on that front, the government will take a decision. What seems to be a priority at this point of time for Maharashtra state is that there are many districts in Maharashtra which had not shown these many cases even in last year when COVID was on its peak. So that is the concern. Hence, they are going after the religious gatherings, they are going after weddings, any crowding which is happening, the action is being taken, and that is the period of 8 days.
You know, that's a very good point you mentioned, Mustafa, and let's understand the reason for that from Swapneil Parikh. Dr. Parikh, why is it that Maharashtra is seeing this sudden surge and sudden spike? In fact, even when the COVID was at its peak, Maharashtra was always topping the charts, and now this new strain, is that what is the big problem in, you know, specifically Maharashtra? We are seeing a spike coming in, the highest spike always coming from that state. You live in Mumbai. What's going on there?
I think, you know, cities like Mumbai, Pune, they're very densely populated. I think there's always been the risk in our metros that we're going to start seeing such a spike. The worrying part is that we're also seeing this in rural parts of Maharashtra. And we're saying Maharashtra now, but we need to really think about this in the context of, is what's going to happen here happen throughout the country at some point? And I think so. You asked about, we were discussing earlier about mass gatherings, weddings, religious gatherings. We have to always think about transmission in terms of the epidemiological triad. So one of the factors is human behavior. That's the big one. As our behavior changes, as our social contact patterns change, transmission dynamics change. You know, pandemics can be as much of a force of nature as earthquakes. But unlike seismic waves, pandemic waves are driven by human behavior. Then we also have the agent, that's the virus. The virus can also start to change to become more transmissible. So we have to contextualize both factors. Maybe there are some changes happening in our own behavior that are in our control, and there are some changes happening in the virus that aren't necessarily in our control. But if we suppress transmission, the less opportunities we give the virus to replicate, the less worrying mutations will occur. So that's really the takeaway message. Keep transmission low, immunize people, especially in areas where there are large outbreaks. In parts of Maharashtra where this is happening, we should prioritize those areas for a high number of inoculations. And that will also help protect others in other parts because it might delay the spread.
Swapneil, stay on with us. Dr. Parikh giving us the much needed perspective on what is really happening and why we're seeing this sudden spot in the number of cases as well. Now, Maharashtra, remember, has gone through a re-lockdown. This is going to be sending alarm bells to the rest of the states as well. Let's get you what was discussed. Government meetings are not allowed at the moment. On your screens right there. Large-scale protests are not allowed at the moment in view of the virus and the pandemic. Religious gatherings not allowed again. Political tours not allowed again. Let's go to the next one. Religious tours not allowed at the moment. In view of the virus, these are the precautions that need to be taken. Let me bring in Mustafa Sheikh, who's standing by in Mumbai, getting us the latest details. Mustafa, is this applicable to the whole of the state, or is it only the parts that have gone through a full lockdown or a partial lockdown, or in case of Pune that has gone through a night curfew, Mustafa?
These general restrictions are implying at the entire state at this point of time, Seti, because we are in a crucial stage. The Maharashtra cases are rising for COVID-19, and we don't know where it will stop and what will be the peak. Because as Dr. Parikh was also telling us, the trend which has been shown by cities like Amravati, Vashim, Nashik, it's very shocking because the peak was never reported like this. If the start of these cases are 1,000 a day in these cities, then what will be the peak? So that is the main concern. And hence, these general restrictions have been placed on the entire state. Though there is no written guidelines by the state of Maharashtra which have come out after the speech of Uddhav Thackeray, which happened yesterday. But we can say that each and every local authority has been given this responsibility to control the cases on local level. Wherever they find that there is some kind of mischief, there is some kind of negligence on the part of COVID protocol, they have to take action immediately. And these are the reports which we are getting. There were raids on restaurants in Mumbai, there were raids on hotels and other parts of wedding halls in Mumbai also. So these actions are being taken, but at this point of time, these are blanket restrictions. Specific restrictions will come out on the local level given the rise of cases on a daily basis. Back to you.
Right, and that brings us to the all-important question on why is it that the vaccination numbers are this low? Swapneil, don't you feel that the vaccination numbers are low? What is your message going out even to the government, to the authorities? They're tuned into this broadcast, hearing it from you about the vaccination numbers and the mass inoculation drive. The numbers are at the moment a matter of concern, Swapneil.
So the government set a great target, when we started our vaccination campaign, to vaccinate 300 million people over 6 months. That's 600 million doses, 100 million doses per month, over 3 million doses administered per day. Of course, we can't expect the numbers in the first month to be the same as the numbers in the last month, but the plan to start scaling vaccinations for the most vulnerable in a month or so, that's too slow. Because, with the vaccine that we're using, Covishield, immunity doesn't set in right away after the first dose. It takes some time for people to be protected. So if we want the elderly and high risk to be protected in a few weeks, we need to start inoculating them today. One of the huge issues in the vaccination drive is that right now, it's basically the public sector. The vast majority of India's healthcare capacity is in the private sector. We need to leverage that. And we need to make the vaccination process a little easier.
The vaccination process becoming easier, do you think there is a need to fast track the other vaccines as well and bring them faster in the market so we have a larger number of people getting mass inoculated ASAP?
Absolutely. Where India is fortunate to have several vaccine contenders, specifically one made by Novavax, the Covovax vaccine. I know there are some trials that need to be done. There are a few other vaccines also. The government needs to prioritize those. We need to move through that process very quickly. Very importantly, we also need to ensure that the number of vaccines we have in storage right now is in the tens of millions, just sitting in the manufacturer storage area. We need to start procuring those and putting them into people, because inventing a vaccine and authorizing it doesn't save a life. It's when you put it into someone, when you inoculate them, that it saves a life. We really need to distribute these vaccines on a priority basis. We need to involve the private sector ASAP.
Involving the private sector ASAP becomes important and imperative, according to Dr. Swapneil Parikh. Mass inoculations need to scale up. We are seeing a spike in the numbers as well. This remains to be our top focus. We'll continue bringing you all the updates as far as coronavirus is concerned. Remember, viewers, the pandemic is here. It is not over as yet. Follow all the precautions. I thank you very much, Dr. Swapneil Parikh, Anisha Mathur, Mustafa Sheikh and Nolan Pinto for joining us on this broadcast.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.